Assalamu alaikum everyone. I'm Dr. Dania Amir and today I'm here with a very interesting topic and a question that is very much frequently asked, like when to seek medical guidance in a suspected COVID infection. Right? I will repeat, when to seek medical guidance in a suspected COVID infection, because there are a lot of people who do get this virus and then they ask me that what is the right time to consult a medical doctor. So since we all know in majority of the people this virus is going to heal by itself with the help of natural immunity, it will take its milder course and then the person gets better in few days time. Generally the trend is this way, but anybody who is having pre-existing medical conditions, like in the form of diabetes, in the form of hypertension, in the form of any pre-existing lung disease like asthma, chronic obstructive pulmonary diseases, or any underlying lung abnormality, lung condition, or any kidney disease or any comorbids, they are high risk patients in which this virus can actually get the severest form. Or anybody who's in the older age population, like above 50 years of age, they can get the severe form. Although the exceptions are there in the young population also, we do say some critical cases, but I'm talking generally. So I'm going to be talking about those signs and symptoms which should be addressed properly and in which medical guidance should be sought immediately. So if your fever is not breaking down with the help of antipyretics or medicines that lower down the temperature, if you have constant fever that is prolonged more than 3 or 4 days, if you have shortness of breath, very important symptom. If you are running short of breath, you are having difficulty in breathing, you are having a lot of cough, which is very difficult and very much continuous, you're having chest tightness, then that is the right time to seek medical guidance. Why? Because in case your lungs are getting infected and they're getting infected to a larger extent, then you will be getting all of these signs and symptoms, like you'll be running short of breath. So the best thing is that at least if you're running fever, have a pulse oximeter on the bedside so that you can monitor your oxygen saturations. In general, healthy individuals, the oxygen saturation it should be more than 96. Like generally it ranges between 97, 98, 99. It's that much high. But in case you're having any pre-existing lung condition, or in case your COVID infection is there, you're running short of breath and your oxygen sats are below 92, that is the right time to seek medical guidance. Because what we see in our general practice, it is like normally the patients, they visit the hospital facility very late when the disease is advanced, so then it becomes really difficult for the physician also to control that. So sooner the better. So let me repeat, if your fever is unbreakable, you're running short of breath, you're having chest tightness, your oxygen saturation less than 92%, then it is the right time. Why? Because your physician is going to be ordering a few blood investigations and few imagings in which we are going to assess the severity of the disease, like X-ray chest or CT scan is going to tell how much the lung is involved, with the help of basic blood markers in which we are going to assess the inflammatory markers. I'm not going to be going into the nitties and gritties of the test, but the only point is to seek medical guidance at the right time. So if you get all the blood tests done, in which we will cover the basic complete blood count, inflammatory markers, the D-dimer levels, in which it will give you information about the thickness of the blood, because higher the thickness, higher the chances that you will form a clot in your blood. So these are the very important points which will help you, which will direct you to seek medical guidance. So anybody who's having comorbids, like I've mentioned, diabetes, hypertension, lung disease, kidney diseases, anybody whose oxygen saturations are less than 92%, and anybody whose fever is not breaking down despite taking antipyretics, and anybody who's above 60 years of age or 50 years of age or in the older age bracket, then one should get medical guidance, because sooner the better. If you're going to arrest the disease in the early times, in which you have actually not entered the cytokine storm, which is the main problematic thing which we as physicians come across. I think it's going to be really a lifesaver for the patients, and for it will help the physicians as well to treat the patients. So I hope it helps, and now you know when to seek medical guidance. So please do subscribe to my channel and do press the bell icon so that you can get the daily updates, and do pour in your suggestions and queries so that I can address them all. Thank you very much. Kind regards, Dr. Dania Amir. Take care.